My name is Scott Poland. I want to thank everybody for tuning in today. As everyone knows, we are facing unprecedented times. There's a lot of anxiety, a lot of uncertainty about returning to school. And I hope in some small way today, my thoughts will be of help to you. And as Dr. Perez mentioned, this webinar is recorded. And because of all the interest in the webinar, it is being repeated at noon Eastern Standard Time on June 16th. Now, if I had to guess today, I would estimate that we have lots of school counselors, school psychologists, social workers, people who work in special education. And our chat box will be open today, but I'm really curious to know how many school administrators, how many superintendents, deputy superintendents, principals might be on the webinar today. So what I want to ask you to do, if you are that school counselor, school psychologist, talk with your administrators. Tell them about the webinar. Send them a copy of the slides. Get involved in the discussion that's going to focus on the emotional and social well-being of our students, dealing with their fears and their anxieties. And I've been promoting what I call the CALM model. And the bottom line is the C could stand for so many things. But right now, with reentry planning, it really needs to stand for collaboration and communication, meaning that I hope school leaders all across the country are listening and welcoming to input. Staff, parents, older students need to feel involved. I worked personally in the schools full-time for 26 years. And I believe the wisest decisions in education, they're made by a group of people. And everybody needs to feel involved. And I really hope school administrators are available to listen to all the ideas and the concerns on the part of staff and students. And what's the M stand for? We need to all model. We are going to get through this. We will be able to cope. That is incredibly important for students, that the adults in their lives welcome their input, but we model hope and optimism as we all move forward. So everybody tuning in today knows that schools basically closed in early March. Students missed up to 3 months of instruction, and now lots of decisions are being left locally in terms of when your school is going to reopen. Maybe it's going to be in mid-August. Maybe it will not be until after Labor Day, or maybe even possibly in some locations, even later into the fall. But schools will reopen. And today's webinar is all about helping people with their understandable anxiety and fear. And one of the simplest questions is, what would help you feel safer? What are your ideas? And then I've tried to look back through nearly 40 years of responding to school crises, trying to look for things that worked then, things that might be relevant now. And one thought that I hope everybody remembers from today's webinar is this simple. Everyone has a story to tell about being quarantined, whether you were a staff member, whether you were a student. And listening to everyone's story is important. And obviously there'll be lots of variations. And for some of our families and our students, things went well, but not necessarily for everyone. There's some national polls that are out that are a little alarming, that as many as 50% of parents are considering continuing homeschooling. And perhaps 1/5 of teachers will not return. And before the virus, there were in many locations teaching positions that went unfilled. And if we're talking about smaller classes, we need teachers. And a large percentage of parents and teachers oppose school reopening until a vaccine is developed. And all the indications are that will be at least many months in the future. What about the older staff members, like myself, for example? Because we are in an age group that has shown to be most affected by the virus. And I don't think there's anybody who can guarantee that on school reentry, the risk of contracting the virus will be down to 0. So those are major issues for everybody to be trying to manage. I do know the typical reactions that students in particular have to a traumatic event. They don't sleep well. They have nightmares. They have worries. They regress academically and behaviorally after traumatic events like terrorist attacks, natural disasters, school shootings. Concentration is difficult because of the trauma they have experienced. And we know that we have now lost more than 100,000 Americans. So what's that mean for school reopening? A lot of students coming back to school lost a loved one. Might have been beloved grandmother, might have been the favorite uncle, might have been the soccer coach, might have been the choir director at their church. We also know many of our families have experienced financial hardship, and the economic downturn has been devastating for many of our families. We would have to recognize that more children are going to be living in poverty than ever before. More children are going to be homeless. And all of these things mean we need more support for our students. And then what little information we have indicates that child abuse has increased. We know child abuse increases after natural disasters like hurricanes. And preliminary indications are there was more child abuse during the time that everybody was sheltering in place. We hope that went well for all families. We hope families developed new traditions. We hope kids and families feel more connected than ever before. But it would be naive for us to expect that would be the case for every single child returning to school. And what about those key academic concepts? I mean, to be honest, children always regress some academically, even over the space of a normal summer, which is about 3 months. Well, we're looking at really students have been out of the in-school academic session now for about 6 months. And I have a number of teachers in my classes, and I always ask them, how did the virtual learning go? And in all honesty, most were pretty frustrated because approximately 1/3 to 1/2 of the students didn't really participate in the virtual learning. And students missed out on a lot, especially the older students. Their sport seasons were canceled. Their school play, their school musical, the graduation ceremonies, those were very different if they were held at all. And students sacrifice the things they missed in helping keep their school and community safe. Those are things that we must recognize. But there were lots of very big disappointments. And those 8th graders that normally would have visited the high school, that didn't happen. And those elementary students transitioning to the middle school, that didn't happen. But I know schools and teachers have done some really creative things virtually to try to help kids transitioning to feel like they know more about that new school. And schools have done really creative things to try to help kids feel a part of the graduation. And communities have done it as well in terms of the drive-through graduation parades and celebrations in our communities. You know, as a crisis responder, one of the things that I've learned to do is basically not to say a lot. And in particular, I avoid using the term, I understand. Could I really understand? Not unless something like that was almost exactly the same happened to me. So if there were magic words to say to kids that are coming back to school, kids that have lost loved ones, kids that have lost out on what were incredibly important activities for them, help me to understand. I can't imagine everything you've gone through. Though, most important thing to say, I am here to listen anytime you would like to talk about this. And I'm proud to tell you, I got the Helping Parkland Heal Award for my response after that tragic shooting. But the most important thing is the message that I have for parents, and that is, when your child lives in a stable home, when they are shown unconditional love every day, every way, your child can overcome almost anything. It's important for us to all be positive about school reopening. It's important for us to all seek out the people in our lives that are positive and encouraging, and we must be that person for our children and for other people. And reminiscing about just a few of many response to traumatic events, there was Belial Middle School. They got 115 new students as a result of Hurricane Katrina in Northwest Houston. I'm the principal who welcomed everyone, getting input from students, from parents, having meetings. How can we be a lighthouse for your family? And I hope every school will be seen as a lighthouse to support students and their families with everything they have been through. And then my previous district, we had a district-wide safety task force. So what am I really recommending right now? Every school needs a reentry task force, and the principal clearly should be the lead person, but we need input from nurses, counselors, school psychologists, teachers, very importantly, parents and older students. And a principal could hold that meeting next week via Zoom. Form your task force. Get the input. This can't be two people sitting around in an office and make all the decisions. The administrators need to welcome input from everybody. Now, we need to help the adults first. Something that I often share. And by the way, we got on a plane for the first time last weekend. It felt really strange, but it did all work out. And there were a lot of safety precautions in the airport, as there will be in every school in America. But if somebody is traveling on an airplane with a small child, and there's a problem with the oxygen level in the cabin, whose mouth does that mask go over first? It goes over mom and dad. So really, administrators, what am I trying to say to you? You want to help your students be ready to return? You reach out to their parents. You reach out to staff members. You get their input and help the adults first with all their understandable anxiety about returning to school. And this is only rarely, but it has happened where school personnel after a school shooting have said something to me like this: I felt ordered to go back to school. I felt unprepared. Nobody reached out to me. Nobody asked for my input. Well, we have several months before school is scheduled to start anywhere. And no staff member, no family should feel like they have been ordered to come back to school without having some kind of a say about what is going to be done. Essentially, everybody's safety and security has been threatened. Maslow, with his pyramid theory, he's the guy who had it right. You know, when fear enters a classroom or a school, learning is the very first victim. That's why taking care of basic needs physiologically and for safety and belonging are so important to have students returning to learning. And it occurs to me that the anxiety falls into two categories: fear of catching the virus upon school reopening. And I believe this is first and foremost what we need to deal with. Secondly, a lot of fear about being significantly behind academically. But let's deal with that, all that anxiety about possibly contracting the virus if I return to school. We need to work on that first. Then we can try to concentrate on the academic regression and trying to catch up. And I think especially high school students in our country have been under incredible academic pressure to get into college and to get into just the right college. Whenever I have the opportunity to talk, I try to lessen some of that pressure. It will work out. I'm an example of somebody who got kicked out of college the first time for poor academic performance. I had to go to a couple of junior colleges. Maybe it turned out okay. So anything that principals, school staff, and parents can do to relax a little bit about the academic pressure on high school students would be very helpful. So, action steps for administrators. Follow all the guidelines from the Center for Disease Control. There's likely going to be increased testing. We're going to have people wearing masks. We're going to have increased cleaning. We're going to limit class size and student movement. Those things are actually easier to determine and carry out. But we need to keep lines of communication open with staff, parents, and students. For example, if I'm a high school principal, I could do a little video this afternoon on June 10th. Here's where we stand. Here's what we're doing. Here's what a sample classroom is going to look like. Get information out there. Now, a really great challenge is, how are we going to know which staff members or students lost a loved one to the virus? And one approach would be via phone calls, a call to every single family. Now you may be sitting here saying, well, there's too many students. Well, obviously, we would divide that up. If I'm going to have 22 kids in my 7th grade homeroom, I can make 22 calls. And I can listen to the story of every student who's going to be in my class. and I can inquire about how the quarantine has gone for them and whether they do in fact know somebody who contracted the virus. Hopefully they recovered, but sadly, a lot of students will know individuals that were very important in their lives that did die from the virus. And as a principal, an assistant principal, how about a phone call to every single teacher, every staff member in my school, checking in with them? How are you doing? So we can do this individually. We can do it by scheduling Zoom meetings, but everybody has a story to tell and everybody needs to be heard. Another approach would be as simple as send out a survey, and it can't be just like yes or no, I'm ready to return to school. It needs to ask some pretty detailed questions and welcome input. What would help you feel safer? What are your ideas to what we can do in our school? And a lot of school staff have done extraordinary things to help students during this difficult time. And we need to celebrate their commitment and their creativity. And I believe strongly that when that return to school does occur for staff, I believe the desks need to be in a circle with proper physical distance, of course, but everybody needs a chance to share what is on their mind. So, other action steps for school administrators. I've described several ways to get them involved in the reentry process. Survey would be one, phone calls would be another, sending an actual letter would be really important. And wouldn't it be great if we could say, the reentry task force at Davis Elementary School, composed of X, Y, and Z, has had a number of meetings. Here's what we have come up with thus far, and we want to communicate with you. So provide opportunities for parents to have input. I believe the greater the parental input, the higher percentage of their children will actually return to school. And I've mentioned several ways about staggering meetings or having a Zoom meeting to try to help everybody feel involved. Now, a thought about high school. What about simply pass or fail for the first grading period? Let's not worry so much about an absolute number or a letter grade, whether it's an A or an A minus. What about just pass or fail until we sort of get everybody back into the groove of learning and we deal with their understandable anxiety? My partner is a former director of instruction, a middle school and a high school principal. We've developed a lesson plan that we recommend be implemented in all classrooms next fall. But obviously, teachers need to be trained on the lesson plan. That would be during staff meetings before the students return, but a classroom approach. And as part of this webinar, everybody did receive a copy of the Teachable Moment lesson plan. Feel free to modify that and use it in any way you wish. But it's basically as simple as let the students be heard. Let's find out what's on their mind, what their fears and anxieties are, and then we'll be better able to move forward. So the questions on the Teachable Moment lesson plan. What was the quarantine like for you and your family? What are your fears about being back at school? What would help you feel safer? What can we do? I also believe strongly that when an administrator in a faculty meeting is willing to just share a little bit of their emotions, that pretty much gives everybody permission to share what they are going through. So what can teachers do? We want them to be calm. We want them to be optimistic. I gave a practical example of reaching out to every kid that's going to be in your homeroom. And be excited about kids being able to go back to school. I believe many students will be incredibly excited about being in the same room with at least some of their friends. And we want all of our teachers to emphasize X, Y, and Z. Here are all the safety mechanisms that are in place in our school. And these were developed after our school not only followed the best advice from the Center for Disease Control, but we got input from school staff, parents, and students as well. I don't think I can repeat enough that every student has a story to tell, and their experiences may vary greatly in terms of, for some of them, things went pretty well. They actually feel closer to their family now. For some of them, it was a very difficult time emotionally. And some students kept up fairly well with school assignments. Some students, to be honest, not at all. And I heard somebody refer to a lost generation. Well, I think that's a great overstatement. I believe through hard work on the part of school staff, students, families, students, yes, they will catch up. And the more we attend to their emotional needs, the better they're going to do at catching up. And part of that in-service time with our staff needs to remind everybody what to look for in terms of the signs that one of your students was abused, or what to look for in terms of whether or not a student and their family might have lost their home. And let's make sure we marshal our resources with the McKinney-Vento Act to help homeless students. And we need teachers to implement the reentry teachable moment. So few more points about it in terms of it should be easy to do, should be efficient, and school psychologists, school counselors, teachers that are maybe not quite so comfortable with leading a discussion, leading the group, school psychologist, school counselor can be in there that help those teachers that don't feel quite so comfortable. And, you know, as I'm preparing for, sadly, our college lost a much beloved staff person, and I'm leading Remembrance Zoom meeting tomorrow. Am I nervous about it? Of course. Am I worried that maybe I won't say the right thing or something won't come out perfectly? Of course. But it's really all about everybody being together when schools return. Everybody in a circle. There's no right or wrong way to feel. There's no right or wrong thing to say. It's about having the opportunity to share whatever is on your mind. And in some of the planning, like sometimes things get postponed, but if things get postponed, then we never really have a chance to talk about it and be together. And I think the teachable moment should happen first morning, first class, when kids are back at school. So we're really hearing from them, we're really checking in with them, and we'll be able, through this universal intervention, to determine which kids are going to need much more help than we can provide in an initial group setting. So administrators, they need to know some teachers will be very comfortable leading the discussions that I just outlined. Others are going to need lots of help. So training for teachers and just showing I care, I'm here. Whatever is on your mind, please share it with us. So action steps for teachers. Okay. In our high schools, there are some really complicated courses. There are some courses that have prerequisite material, but unfortunately, several months of quality instruction was lost. So teachers have to meet together and go over. You know, as the chemistry teacher, I just wasn't able to cover this material as well as I normally would have. And that's left some gaps in knowledge. And we must address this in the next course in our science curriculum. So that'll be a challenge academically at the secondary level. Not quite such a big challenge at the elementary level. And at the simplest level, I hope everybody can just take a deep breath, maybe even take several of them, and say to yourself, I can manage school reopening. I will model being in control and optimistic. I'm going to take care of myself. I'm going to take care of my students. I will be that positive person. And one of the things I believe is really important is we stay away from politics. The first time somebody wants to talk about what the governor or the president did or did not do, this isn't about this. This is about everybody being together, following the guidelines that were established in our school with the input from key stakeholders. And we have to make choices as a parent. Am I going to focus the most on my kids' academics and getting their homework done? Or am I just going to focus on letting them know how much I love them, care about them, and focus on their emotional well-being? Same thing for an academic teacher. Let's focus on helping kids with all of their understandable emotions, such as fear and anxiety. I hope every family, I hope every classroom feels more connected than ever before because of what we've all gone through. Well, what are the worrisome signs of student stress? We've already mentioned the word anxiety, worry, and fear several times, but they may feel on edge. They may have changes in appetite, energy level, activity level. In the phone call to students' homes, which I would like to encourage you to talk first and foremost to the student, but also, can I put your mom or dad on the line? Ask a little bit about how they've been doing with regards to just basic things about sleeping, eating. Talk with parents and invite their input about ideas to help their child be ready to come back to school. We have to expect, in fact, I think I could argue the emotional and psychological needs of the students in the fall of 2020 may be greater than ever before. And we need to make sure we increase our mental health services that are available to students. And irritability, concentration problems, that irritability may lead to some outbursts, and it may result in visits to assistant principal and discipline issues. But I think if everybody can understand, where is a lot of this coming from? Fear and anxiety. With our older students, there may be increased usage of drugs, including alcohol. And I think we'd have to acknowledge that many students live in families where substance abuse is a problem. And it was probably a greater problem during the quarantine than ever before. More students and more staff members may have thoughts of hopelessness, helplessness, despair, and even thoughts of suicide. So I hope that in those in-services, the administrator will take time to ensure that everybody knows the warning signs of depression and suicide. Everybody knows the referral procedures in our school. Everybody knows not to keep a secret about somebody making suicidal statements. And everybody knows to work as a team to help staff and students. Some simple things for managing stress. And in my previous job, I was often asked to work with a staff member who just had a traumatic loss of a loved one through death or separation. And in talking with them, I'd always gently inquire about, before this traumatic event happened, what were the things you just did routinely to try to cope with the ups and downs of life? And I got simple things like relaxation, exercise, getting enough sleep, avoiding excessive alcohol or caffeine. And then I would ask, or maybe I would hear calling a friend, working in my garden. Then I would ask, well, since your partner left you, are you still doing those things? And almost always I would hear, no, not at all. I haven't had the energy. I just haven't done any of those things. Well, the key point here is what helps us deal with just the normal ups and downs of life is even more important right now. And as a crisis responder, I just like to ask everybody, who or what has helped you when you've had a difficult time before? Who or what is helping you now? So we have to help people remember their existing support systems. And I try to just stay in the moment. What is right in front of me right now? And don't worry about things that have not even happened as yet. And remember, we choose how we respond to things. And connections with our family and close friends. And this fall, we're going to have a chance to really connect with our work family. And we need to view that as a very positive thing. And for the last few months, I've been cautioning everybody, don't be glued to the news, because for the most part, it has not been very optimistic. I know it's a lot better now than it was 3 months ago, but very importantly, we need to make sure that developmentally we consider what information is it that is actually appropriate for a young child. So talking with students, it's really all about listening. It's about finding that time when the kid in your house or the kid in your classroom will actually talk to you. And what I learned is with my own children and working with students for all those years, adults have to be careful not to talk too much. And by the way, kids don't want you to say, do this, do you do that, you won't have a problem. They simply want to be listened to. And all students on returning, they need to have an opportunity to talk about it if they wish, or to express their thoughts and emotions through artwork, music, projects, ceremonies. Writing, journaling is very positive for kids. And it's almost like the younger the kid, the more we're getting out the markers and poster board. The older the kid, the more we're just going to talk about it as a group. And all of our students need to be reassured. The smartest scientists in the entire world are working on this. And if somebody contracts the virus, we're going to get them the best medical treatment possible. And also to remember that the vast majority of individuals who contract COVID-19, they do recover. And would be my hope that some students coming back to school will say something like, I had more time on my hands than ever before. I learned sign language. I learned to play the guitar. My mom and I started a project on X. We're investigating, we're looking at some issues historically. We now have a stamp collection. My dad and I now have a coin collection. Hopefully they're going to be able to share some of those things. But at the simplest level, we actually have a lot of heroes. They were the people working in our hospitals. They were our police, our firefighters. They were the people that kept delivering the food to our grocery stores and putting it on shelves. And a very positive activity when we're back in classrooms is to simply ask our students to write a letter thanking one of those individuals. And probably a lot of people on today have never heard of Dear Abby or Dear Ann Landers, but there actually used to be a newspaper column. People would write in about a problem and they would be given advice. So one activity in a 7th grade classroom could be write a letter to one of your peers really stressed out about the virus and school return. Write a letter to them. What ideas do you have for them to help them cope? And you know, when we talk to students and we don't know something, we just need to be honest. And a phrase that I've used throughout my career is this simple: it's hard not to know. I know everybody listening today would like an absolute answer about what school reentry going to look like. Will I have a choice as a staff member to return? Will I not have a choice? How is this actually going to work? Well, we don't have all those answers yet. It's hard not to know. But we do the best when we feel like we have input into trying to figure out the answers to all those questions. Yes, what has happened is unprecedented. We've never dealt with anything like this in modern times. And everybody needs to simply be asked, what would help you? What are your ideas? What will help you feel safer? And everybody does the best when they stay busy. I would acknowledge, I don't know that I've ever been busier. And responding to phone calls, teaching numerous classes on Zoom, trying to prepare these webinars. Keeping busy is going to help staff and students. And kids thrive on routines, and they've been out of the school routine now for many months. So I think getting back into routine, even if it is you only go on Monday and Wednesday, but getting back into a routine will be very helpful to them. And these are the typical reactions that kids have in terms of by ages. And I think everybody understands that younger kids are going to have more tantrums. They're going to have more toileting accidents. They may be needing to sleep with mom and dad for the first time in many months or even years. And as kids get a little older, and those elementary age kids, they may need more attention from adults than previously. They may have somatic complaints. They may be irritable, the sleeping problems. concentration problems. And our middle school and our high school students, very similar, but I'd be remiss today not to say that some of those high school kids, they've been really withdrawn from their families. Some of them have started using substances or are now engaging in more substance abuse than ever before. And all of this would lead to my statement that the mental health needs of kids in the fall of 2020 are going to be quite great. And obviously, we want everybody to be resilient. We want them to bounce back from adversity. It's largely learned. The modeling of the adults in kids' lives is incredibly important. It involves a number of steps. It involves being positive, optimistic, using our problem-solving skills. And in the teachable moment that we're providing, self-care. It's like every staff member and every kid needs a self-care plan. And we hope every kid is surrounded by loving and caring family and friends. And we hope everybody will have the capacity to manage strong feelings and emotions. So our teachers in particular, we've got to identify those students that are struggling academically, those students that are struggling emotionally. And we're going to need more tutoring than perhaps ever before. And to be honest, in my humble opinion, mental health services in our schools are sorely lacking in many places. So how could we increase the mental health support? Leela was a career school counselor. She retired a year ago. Well, would Leela come back to work maybe 2 days a week? Can we figure out a way to pay her at least something? Would Leela or others even consider volunteering so we'll have more mental health professionals in our schools? Or what about our community agencies? Would they place a staff member in our school? We need to be creative and try to figure out how do we increase the mental health support in our schools. Those of you who know me well know my greatest passion has been youth suicide prevention. So what do we know already? Suicide rate in America across all ages is at the highest in 50 years. The actual number of suicide deaths total more than 48,000 for the last year available. So what is this virus going to do? Well, there have been some rather dire predictions, but we already know suicide's the second leading cause of death for every student over the age of 10. Everybody needs to know what to look for and what to do. As I could make the case, because of losses through death, because of financial hardship and loss, suicide rates could drastically increase. But suicide is preventable if everybody just knows what to look for, what to do. Push the button on your smartphone. You'll be connected with the 24-hour crisis helpline. This is a time when every school in our country needs to review the suicide prevention plan and make sure everybody knows what to look for and what to do. And more children will be living in poverty than ever before. And that's an example of an adverse childhood experience that is related to depression and suicide. And maybe more children than ever before are returning to school after the loss of a loved one, another adverse childhood experience. So a couple of final thoughts, and then Megan and Janine may have some questions, but our behavior is really important. What can we control? We can control our reaction. We can ensure that we follow all the recommended safety guidelines. We can be positive about school returning. We can ask, does your school have a reentry task force? You want to be on it, of course. They don't have one? Let's start one and really welcome the input from parents, school staff, and students every step of the way. School mental health professionals, you are needed at this difficult time to get involved and help administrators anticipate, plan, and develop strategies to deal with all of the fear and anxiety. And as adults, we've had a lifetime of experiences drawn. Everybody listening today has been through very difficult times, and we need to draw on those experiences, and we need to model coping and hope. And I'm not talking about telling everybody about how you got through a difficult time. I'm just talking about modeling. We will get through this. Life has been a tremendous struggle, but we will get through it. And that's what we need to model for everyone. So I'll turn it back to Dr. Perez, Megan, and Janine. Let's see what questions we might have today.
All right, so we have a few questions coming in. We do have a lot of questions asking if the PowerPoint slides will be made available. I know that the lesson plan was sent out, and then there were also a few other people that weren't able to access that. So are they going to be resent?
Well, it is certainly fine with me for the exact slides to be shared and utilized in any ways that'll be helpful to you. But let me ask Dr. Perez, is it as simple as we just say, yes, we'll send out slides?
I will send everybody that's registered and on here today a slide. If you do not, the slides. And thank you, Dr. Poland, for providing that. Many of our presenters don't share their slides, and it continues to show your generosity and your care. Thank you so much, and I'll make sure we email them to everyone that's registered today, and you could share them. We are happy to assist you.
Thanks. And I think the other thing is encourage some of your coworkers, especially your administrators. Let them know, yes, today was recorded, but it's also being repeated on Tuesday, this coming Tuesday, June 16th at noon. So what else do we have, Janine?
All right, so there's a question. If you're working in a school, how do you progress monitor how things are going? What tools should administration and student services use to make sure everyone is okay?
Wow, well, that is a really complicated one, but I think that checking in frequently, the idea is hopefully pretty quickly in classrooms, we're gonna be able to determine which kids are really struggling, whether it's emotionally or academically. And then they need individual assistance from school psychologists, social workers, and school counselors. And particularly at the high school level, that's why, and somebody might say, well, how can you possibly say pass fail for the first grading period? But why not? We're dealing with unprecedented times, and let's be patient about some academic things and be continually checking in using all of the tools currently in place about emotional monitoring and academic monitoring. But sometimes, in fact, going back to all those kids that came to Houston as a result of Hurricane Katrina, it's like, first thing some teachers wanted to do is like, let's give them a math test. Let's find out where they are. Well, that's not what we want to do in the first few days of school. Let's really focus on how are they doing emotionally.
There's someone said, I'm a school counselor and my concern is how can I provide services to kiddos and also follow social distancing guidelines when 90% of my job is in direct contact with students, parents, teachers, and other staff?
Well, these are things to be determined obviously locally, but I think we talk to people, yes, we just try to maintain that 6-foot distance. And in the beginning, schools may just require everybody to wear a mask as much as is possible. But I think to really help people, we've got to be in the same room as much as possible. And we just maintain that 6-foot distance.
All right. At the high school level, how can you help teenagers understand the seriousness of COVID-19 if they haven't been severely impacted?
Okay, great question, because I imagine that I'm not the only person that's been aware of teenage gatherings in my community, aware of lots of kids outside. So much of this really is a decision that has to be made by parents. And I know that I had really thought the virus is out there. Thankfully, I don't know anybody who died from this virus, but I now do. And as we really start to think about our connections in our schools and communities, a lot of people have died. And maybe giving teenagers some of the facts about their county, their city, their state. Well, let's just look this up. I know everybody wants this to be like over, something that we basically, let's just move on like it never happened. But unfortunately, that's not the case. And I think we also have to prepare for the fact that it's possible that some schools will reopen and then the decision will be made it's not as safe as we hoped it would be. So providing teenagers information, let's do a little research here and let's find out what are the best scientists saying? What is the incidence of this virus in our community?
And then I know that we're running close to the end of time, but I have one more question. Can you give your opinion on the academic impact and the way school psychologists look at specific learning disability referrals in the future?
Okay. Well, this question reminds me of when we got all those new students from Louisiana as a result of the hurricane. Pretty much everybody was immediately thinking, I mean, I know he's 14 years old, but now I think he has a learning disability. And one of the things that I thought was, he's 14. They didn't think he had a learning disability in Louisiana. Let's not rush to that right now. So I hope that every case would be looked at individually, but there won't be a rush to think the answer is they suddenly have a disability that they didn't have before. I think it's more a matter of meeting students where they are, providing them what they really need to be successful, and not drastically increasing our referrals to special education. And the more time that a school psychologist spends testing, the less time they actually have available to talk with kids about what is really on their minds.
All right, and then do we still have time to take a few more questions? I know it's 1 o'clock, but.
Maybe one more.
Okay. Let's see. As a school psychologist, I suspect we will receive several parent and/or teacher requests for full and individual evaluations once we resume school in the fall due to regression of academics and emotional or behavioral functioning. How do you suggest properly communicating to families and school staff about how impactful this quarantine will have on students, which could potentially impact their educational performance?
All right, a great question. And I think that my thought would be the core group at school psychologist, administrator, special education personnel, they need to sit around the table and they need to determine what things will we really look for? What reaches the threshold where we would actually refer for that evaluation? Because some regression is to be expected. And let's try to do as much as we can in our regular education classrooms to help kids catch up. Let's try to add as much tutoring as we possibly can. So I don't believe this is the time to dramatically increase the referrals for suspected disabilities. I think this is a time for good planning to make decisions about what's reasonable in our school to respond to a parent request. I now want my kid to have a full evaluation.
Okay.
Well, I want to thank everybody for listening today. And I want to say quite honestly, I don't have all the answers, but teams of people will make wise decisions as we move forward. And I want to thank Dr. Perez for organizing this webinar, and I'll turn it back to him.
Well, thank you so much, Dr. Poland. As I mentioned earlier, I will email all the registered individuals but probably within an hour or so. And we really appreciate that they're sharing these with their districts. We don't have every answer, but we're here to have part of the conversation. And I especially want to welcome everyone to a very special presentation we are having on Friday that will touch on the Black experience in America. And we have 5 incredible panelists. And Dr. Poland, there's been some questions on COVID, and I think we're going to be discussing those as well on Friday a little bit. But thank you so much for your time.